that we are following the same attendance protocols this quarter. So everybody needs their camera on, no blurred background, and present for all. And Zoom is producing these reports that I then send on to attendance and they look at it. So I don't have any say in the matter. But so we're starting this week. There wasn't something in your announcements, which one of your classmates pointed out to me. I didn't realize I had put it in there, but we're going to be doing a case study tonight. I hope everybody saw the lectures that are on announcements for week 1 and week 2. That's where you will get your lectures. Okay. So they're at the bottom of the announcement, both week 1 and week 2. We do have our exam review following class tonight. If you guys want to join, stay on, that's fine. If not, I will send the recording. Professor Price has already had one. And so I'll post hers and mine. And when I post the exam recordings, what I will do is I will do one announcement and just update as the new recordings are posted. So it'll say like review and it'll have mine and Professor Price. And then as the other ones come up, I'll just update that announcement. So just keep an eye on there because there should be several of them there. Any questions about the exam for next week? No?
The exam is on week 3. I thought it was on week 4. Maybe I'm just.
Yeah, it's week 3. It's on your syllabus.
Thank you.
So you do have your study guide that was sent out to you guys. You have PowerPoints for every chapter that's been sent out to you via email. So all those things you have in your with your resources. If you are attending one of the study sessions, which we are expecting you to, and we do take attendance at them, please make sure that you have your study guide printed out because we will go over that as part of the review. Okay, so it'll cover contents from chapter 1 from week 1 and week 2. So for our exam next week, that will be all we will do in class is the exam. So you guys will be free to go when you are done, but no, it's on a recorded, you have to have your phone and your computer working, right? Like you always do, so that you'll have 1-in-1. What else can I say about the exam? I think that's it. It will be ready for download 24 to 48 hours prior to you guys taking it. So please keep an eye out. It'll be on ExamSoft. And I do need to, so I need to make sure that that's all in play. Like I said, for attendance policy, what I will tell you is I have no say in the matter. So you guys have to be signed on and logged on at 6 o'clock according to Zoom. Dr. Brown looks at that. I don't have anything to do with it. So please make sure you're on and your cameras are on as well. All right, I'll take attendance real quickly. And then we will get to our work for this evening. Esther. No, Esther. Esther, you asked me about the test. Oh,
sorry, are you talking about Esther?
You go by Esther. That's what you told me last week, right?
Yes. So that's me.
Okay. Yep, that's you. Okay. Ashley, I see you're here. Welcome. You're here.
Yes.
Welcome. Asada.
Here.
Thank you. Roxy. No, Roxy.
Here.
Oh, thank you.
I'm here.
Brittany. Brittany. You're here, Brittany. Okay. Raphael.
I'm here.
Okay. Maya.
Here.
Okay. Martha.
Here.
Matthew.
Here.
Angela. No, Angela. Adriana. No. Okay, Michelle.
Here.
Julie.
Here.
Marissa.
Here.
Marissa here.
Yes, here.
Okay, Yesenia.
Here.
Alejandra.
Here.
Rachel.
Here.
April.
Here.
Tatiana.
Here.
Anna.
Here.
Emoti.
Here.
Paula. Paula?
Here.
Okay, good. All right, so we're missing a couple, but anyway, there's no Angela and there's no Adriana, right?
You didn't call my name.
Are you not on my roster? You're not on my roster. Are you in an add-on, Andrea?
Yeah, they added me after.
Okay. RESAFDIZ. Okay, you're here. Okay, because that's good to know. Alrighty, so this week I did some lectures. You did a lot of chapters that you had to do in your reading, and I hope everybody is prepared because what I spoke of last week and we will continue with this week is we're going to be using our knowledge that we have gained over our reading and with our lectures, and you guys are going to apply them. And so you're going to be responsible for knowing the material when you show up for class for this week and last week. And for week 4, you'll need to know week 4's material. Okay, so what we're going to do is we're going to do a case study. Prior to that, though, there is a concept that I want to go over that I don't feel I covered very well in lecture. And so I did a little PowerPoint for you guys. There's 3 levels of prevention. What are those 3 levels?
Primary, secondary, and tertiary.
Very good. And this is going to be a big concept in community nursing. And I want everyone to know about this. So I'm going to show you, I did a little PowerPoint just to go over it because I don't feel like I presented much of it in our lecture. So when we take a look at our levels of prevention, we have 3 different levels. You have primary where there's no disease. You have secondary where we're going to do our screenings. We're going to be looking for people that may have something. And then we have tertiary prevention where we already have a disease process. And so we're doing our best to minimize the consequences of these 3. So when we take a look, it's on a spectrum, okay? So understand primary means there's no disease present. Secondary, you're going to have asymptomatic disease. And then tertiary, you're going to have your disease process. So when we look at 3 levels, we have our primary, which is what's going to prevent our disease process from beginning. So what are some examples of primary prevention that you guys read about?
Immunizations.
Yep, good. Vaccines, what else?
I like public health fairs and
Like studies.
Educating.
Yeah, educating, studies isn't going to be primary prevention because that's not doing anything to prevent disease process on a person. But absolutely education, vaccines, studies is how we find information and how we worked on a chapter with evidence-based practice, which I think is what you're referring to. And we did talk a bunch about studies there, but good. So we have vaccines, we have educating, we have all that kind of stuff. Then we have our secondary prevention, and then we're going to have this intervention that happens early on in our disease process before you even realize anything's wrong. So what kind of things did you see for secondary prevention?
Like screening.
Like TB tests.
Yeah, screenings, any kind of screenings. Good. So TB test. What's another one you guys read about?
A1C.
Yep. We're not going to now, we're on a screening like an A1C, we're not going to do that on diabetics because then they already have the disease process. We're going to do that on people when they go for their primary visit, right?
Like mammograms.
Yeah, absolutely. Mammograms. What else with as
Colonoscopies.
breast health?
Diet and exercise?
Self-breast
No.
exams.
Yeah, self-breast exams. Diet and exercise is not going to be doing any screening. That may be an education that you're teaching people to stay healthy, and that's going to be in our primary prevention, right? And then we have tertiary where we already have signs of a disease, so this is going to be our treatment. And so any type of treatment we'll see tertiary. So our example with diabetes is primary prevention. We're going to have our healthy patients adopt a healthy diet and exercise to prevent diabetes. Then we have our secondary. We're going to do those blood glucose screenings to identify diabetes early on. And then we have our tertiary, we're going to use medicines to treat diabetics in the hope of decreasing the severity of their symptoms. Okay, does that make a little bit of sense when we look at that example? And here's a little mnemonic. I like to use mnemonics in prevention. And so we're going to have our primary, which is P for prevention, secondary, which is S for screening, and tertiary, which is T for treatment. Okay. So that's how we remember that. PST, primary, secondary, tertiary, prevention, screening, and treatment. Oftentimes when you're looking at our secondary prevention, you're going to see the word screening in there. That'll sort of give you a clue. So any questions on primary, secondary, and tertiary? All right, we're gonna do a little Kahoot with it because I just want to make sure everybody is very comfortable with this. This will be something that you'll see on your test. You're gonna have examples and things like that. So let's take a look at our Kahoot. Does everybody know how to do a Kahoot?
Yeah, I gotta re-download one real quick.
Yeah, you shouldn't have to download. You just go to Kahoot it, Kahooit. And then you'll have to put in the PIN code. So I'm going to give you the PIN code in just 1 second. All right, so we're going to play in classic. I'm sharing, it takes too long, so I'm not sharing. Oh. All righty. I don't know why it's taking so long tonight.
Oh, when you're done, can you please give it back?
Okay, here is our PIN for this evening on our Kahoot. It's 968-8981. So sign in. You don't have to sign in as yourself. You can sign in whatever. All right, so here we go. We're going to start. Our first question is going to be. What's this at the bottom? Define primary prevention. And so then here's our 4 options. So pick your best choice. All right, excellent. Actions that prevent our initial occurrence of disease. The word prevent is right in there. Somebody pick screening, and screening is going to be what level of prevention?
Excellent. Screening second.
Secondary.
Yep, secondary. Yep, good job. Okay. Let's go on our next one. This level of prevention is a primary prevention.
Okay.
Very good. All right, 4 of us picked regular medical checkups. Why would medical checkups not be a primary prevention?
Is that still kind of considered in the screening process?
No.
Because we're not really doing anything to prevent any type of illness.
Yeah, there's no prevention aspect to it.
Yep. And when you encourage, what do we know about encouraging?
I can only do so much.
You can only take them so far. How many of us in healthcare know? We tell them to make sure you make your follow-up, and then they never do, right? So if you weren't encouraging, if you were making a regular medical checkup for someone that had no consequences, then that may be something we could look at there. Or something that goes along with medical checkups is like our screenings that we do. But good. All right, here we go. Next question. We just did this one. What's primary prevention? So I'll skip it. All right, self-breast exams would be considered which level? Good. We just went over that in class, so I was hoping everybody would get that. Why is it secondary?
It's considered a screening.
Yep, you're screening with a self-breast exam. You're screening to see if there's anything unusual that you find. Good. Chemotherapy is considered which level? Good. I don't know. We're kind of all over the board here. So guys, for primary, it's always going to be the ones that are, you have no illness present, right? So how could you have chemotherapy if you have nothing wrong? And then we
Yeah,
have
I did
secondary,
that
which is
one
going to
by
be our
accident.
screening.
The
So
cancer,
you're not screening because you're treating, and treating is always going to be our tertiary. So careful with these. Most of you guys got it, but I'm just concerned about those of us that are still kind of, the other thing is you're not going to ever have treatment that's going to be primary. Because in order to have treatment, you'd have to have a disease process, right? All right, let's look here. Secondary level of prevention. All right, very good, guys. Everybody got screening on that one, so very good. Here we go for the next one. Example of primary prevention.
What are you doing?
Good work. Everybody did use the seatbelts. Somebody who picked use the seatbelts. Tell me why rehab services for post-surgery patients wouldn't be a choice. Sorry, I still have a head cold. Why is rehab services for post-surgery patients absolutely not going to be primary?
I picked that on
tertiary.
accident.
Go ahead.
Because you've
Somebody
already
was saying
had the
tertiary.
It's tertiary care because they've already had some procedure, and this is treatment after the fact.
Good. How about support groups? What level of prevention is that going to be?
I picked the yellow answer by accident.
Okay, no worries.
Yeah.
What about support groups? What level of prevention would that be?
Tertiary,
Why is that tertiary?
because it's helping them after the process of like whatever they went through.
Okay, and so it's
treatment.
already, they already have a condition, right? So you're not gonna have a support group unless somebody's gone through something. So that's always gonna be, we're gonna see a lot of support groups with tertiary prevention. Good. All right, let's take a look at number 8. Tertiary prevention strategy related to pesticide exposure. Which activity would the nurse complete? All right, so we had most of you guys pick treat a client who has pesticide exposure to prevent complications. And I'm gonna ask, Michelle, did you pick red?
Yes, I did.
Why'd you pick red?
Because it's tertiary, which would be treatment. And they've already been exposed to pesticides. You'd be treating them for the symptoms of whatever they got exposed to.
Excellent. Why did you not pick green?
Because it says provide teaching, so that maybe that would prevent them from being exposed to the pesticides in the first place. That would be more like primary.
Good. Excellent. Great explanation there. So teaching we're going to see is always going to be our primary because we're trying to prevent something from occurring, right? We're trying to prevent them from getting the exposure to the pesticides. Good work. Okay, let's see number 9. Client with osteoporosis to have 3 servings of milk or dairy products. Choose this level of prevention.
and 3 serving of milk dairy products.
Ooh, we're all over the board here.
Tertiary prevention.
Who picked green?
I
can't
did.
see. Okay, whoever just said I did. Why'd you pick green?
Because they already have osteoporosis, so the 3 servings of milk is the treatment.
Is Klein.
Excellent.
procedure.
Excellent,
2
yep.
serving.
So when you're reading something like this, if we were advising clients at the age of
I think that
65 to
buys
have 3 servings of milk or dairy products to prevent osteoporosis, what level of prevention would that be? Anna?
Primary.
Good, good. Okay, so you have to be really careful when we're reading. We have to read our context as well. Tertiary prevention during a pandemic. We just went through one, so we should think about this.
Please have
All righty, good work there on coordinate education on prevention strategies. What level of prevention is that going to be?
Primary.
Anytime you see educate or teaching, you're going to see primary. The only thing that here that's possible for our tertiary is we're treating those people that had COVID. So here's medication, which is a treatment for our COVID clients. Okay, we'll do one more and then. Oh, that one's spelling wrong. So hold on.
no.
All right, multi-select. What are some secondary prevention methods for cancer? All right, so we're going to be having our screenings here. Most of you guys got this. Very good. You're going to have your mammograms, you're going to have your occult blood test, you're going to have your PSA, and you're going to have your colonoscopy. Good. These are all going to be secondary prevention because we're screening different screening methods for cancer. Okay. Any questions on primary, secondary, and tertiary? Because like I said, that will be a big piece of your of all of community health, actually. All right, so now what we're going to do is we're going to take a look at our case study that we're going to work on this evening. Now, when I show you the case study, what I'm looking for you guys to do is I'm going to split you up into groups, and we're going to take a look at this case study, and I have some questions that we're going to share, okay? So here is our case study. Can everyone see it? Somebody want to read it for us?
You are a nurse at a local hospital in an urban area. In the past month, you have discharged the following 10 clients between the age of 23 to 35 who were hospitalized with short-term complications of uncontrolled type 2 diabetes. 3 Latino males, 2 African American females, 1 American Indian female, 2 Filipino males, 1 Caucasian male, and 1 Caucasian female. This has you concerned. You review your discharge planning for this population of young adults.
Okay, good. So we all know our case scenario here. This is what we have. What I want you guys to do is write down the different groups that we have. We have 3 Latino males. We have 2 African American females. We will have 1 American Indian female, 2 Filipino males, 1 Caucasian male, and 1 Caucasian female. So, because you guys are going to need that for some of the questions that you're going to be looking at. Okay. All right, so like I said, we're gonna do a jam board. You guys have certain questions out there, and each group is, we're gonna have 5 groups of you. What I want you guys to do when we're looking at this case study is I want you to use your content that you learned over week 1 and week 2. So each question is very specific to something that we should have covered during week 1 and week 2. So I expect you guys to be using that kind of information to answer. I'll help guide you as we go along. So I'm randomly gonna assign you. Our jam board, we did one last week, so I'm going to tell you guys, I will put it in the chat, our jam board, sorry, our jam board website, okay? And then you guys are gonna log on there. And what I'm gonna do is split you up randomly into your groups. So let's go into the chat and I'm gonna put this.
I'm sorry, could you go back
Mhm.
to the list really quick?
Yep. All right, there's the jam board in the chat, guys, and I'm gonna show you a list of people again. Okay, so we're good there. Everybody on our jam board? Everybody's logged on? Clicked on the link?
On the, I didn't get it.
In the chat, it should be in the chat there. All
Okay.
right, so I'm gonna randomly assign you guys, if you're group 1, you're doing question number 1. So I will show you some of the questions that we're gonna be looking at. Oops. We're gonna be taking a look at some different questions here, and here they are. We're gonna be looking at risk factors, primary, secondary, and tertiary. We're gonna be looking at Healthy People 2030. We're gonna be looking about cultural competency and being in a home and what that will play a part in. Community-based and community-oriented nursing, how do we see that? Okay, so those are our 5 content areas that we're gonna be looking at tonight. And like I said, you guys are gonna be answering the questions and you're gonna be presenting to the class about the content that we should have had for this week. So any questions at all? Okay, we are all splitting up. Amodi, you're off camera.
Yes, I'm moving from the location that I was. I'm sorry.
It's okay, just remind you because it'll pop up on the
I
Zoom
was
thingy.
in my classroom.
Yeah, I just try and remind you guys because I want everybody, you guys are all present, so I want you guys to get full credit, for being present. Okay, so here we go. We're gonna go into our breakout rooms. Everybody remembers how to use the Jamboard with the little Post-it notes? Yes? Okay, good. I see a couple shaking heads, so I'm guessing so. Alrighty, 4 to 5 of you per room, and go.
Now it's not working, so how can I open it? Is there a link I posted, but I download also. It's not working.
Don't worry, just go into your group and somebody else will work on the Jamboard if you can't get it.
Okay.
You see join room 2? Roxana, what's going on there? Amodi, you should be joining your room. You did, good. Roxana, what's going on? Okay, well, I have to put you in the waiting room because Oops. All right, you guys all done? Somebody's on their phone, so I guess you're done. Yeah, all right, we're ending. Oops. Okay,
We figured we were just supposed to leave there.
yeah, I'm closing all our rooms. I didn't realize you guys were back on the main screen. I thought I jumped in your room by accident.
Yeah, we weren't sure if we were just supposed to stay there or what.
Yeah, no, I would have pulled you out, but it's okay.
Okay.
All right, so we all were in breakout groups, and what one group was concerned about, and I need to make it clear to everybody what our goal is here in this class. Our goal is to apply what we have learned to a case study. So you had readings for week 1 and week 2, and so when we gather together to do a case study and get information about it, we're going to be using that material that we learned in week 1 and week 2. Most of us all kind of understood that, but I just wanted to make that clear to everybody. That's the point of doing a case study, and you'll see that this is the way community nursing is being taught. And the reason for that is because case studies is what NCLEX is using nowadays. So we're trying to prepare you on using material and applying it to a setting, okay? So just be really open-minded when we're doing these. When we're doing these. Did anybody have Roxana in their group? No? Yeah, I don't, she's in.
Yes.
You did? Okay.
Yes, I did.
Okay, thanks, Andrea. She was put in the waiting room, but then I don't know what happened. Okay, so we're gonna take a look at what we came up with. All of us did a good job, you guys. Just please be prepared every week with your reading and the lecture. I can't stress that enough, but we're gonna be applying it in the classroom. So I need everybody to be on board and be doing their reading and the lecture and all that stuff by Wednesdays, just so that we can all be on the same page when we're here in class. Okay, so we're gonna pull up our Jamboard and then we'll have each group explain what they found. Here it is. And all right, we're gonna take a look here at, oops, group 1. Our risk factors as a community nurse. Group 1, talk to us about the risk factors.
Okay, so when you came, you were talking about social determinants of health, and then we just did like how those applied to, I guess, diabetes, because that's kind of what we were thinking. So the social determinants of health are economic instability, education, social environment, health, and healthcare and physical environment. And then
Okay, so I'm going to stop you for 1 second.
Okay.
What does that tell you? What does it tell you with economic instability and education? What do we know? What is our finding? If you don't know, you can say you don't know. I'm not putting pressure on you guys. What I'm trying to say is the lower your economic ability and the lower your education, the higher risk you're going to have of chronic illness. And that's been proven over and over and over with our social determinants of health. Good. Okay, keep going.
Okay, so for education, we would be concerned about them being able to know and understand their illness and how to manage it. With economic instability, being unable to afford healthcare or medications that you need for your illness. Social environment, lifestyle choices, and preferences based on environmental features such as spiritual beliefs and work culture. And then we did 2 for physical environment, like the distance to healthcare, like appointments, so like transportation to appointments, being able to go back and forth. And then safety hazards in the home and their environment. And then health and healthcare, what services are available in the area, or specialist or management programs.
Okay, and so talk about your safety in the physical environment, because another group had this as well. What do you look for when you're in someone's home?
So like trip hazards, like anything that, especially a diabetic, could like cut their feet on and be unaware of it, because that can lead to further complications like wounds and then amputation if not treated correctly. And then like, I don't know, I can't think of anything else off the top of my head.
No, you're okay. Your group can help. You've done a lot, Julie. Your group
The
can help.
temperature of their water in the shower,
Good.
because they can't feel because of diabetic neuropathy in their feet. We would want to check that. What else?
How could we help them with getting to their healthcare appointments?
Sometimes I know they have like transportation services that we could provide them with, to help them get to and from their appointments if they don't have the transportation.
Good. We can help with that. Is there anything we can do for them economically? What are we going to be teaching them about economically?
Just like counseling programs, employment programs for people with disabilities that they can, they are allowed to do, or they can allow themselves to do it besides their limitations. So you can teach them about that.
Good. Excellent. Resources that are available in the community. Places where they can look for job employment if they're unemployed, you know, to help with those those social determinants of health, so that we raise them up a little bit so that they can have a better prognosis. Good. All right, primary, secondary, and tertiary. We just did a bunch on this, but this was a good one. And I want this group to talk about this one for me. They were quiet when I was in there too, but they know what they're doing.
So for primary prevention, we would look at like education on like vaccines, educating them on different risk factors for example, like smoking or having high cholesterol, those kinds of things, and then also keeping a food diary.
And why was that primary? Good, Rachel. Why is that primary?
So we can kind of see ahead of time, like maybe like what they're eating, what they're drinking, so we can adjust if need be.
All right, but remember we talked a little bit about primary. We don't want to be doing that treating stuff, right? We want to do, what are we really looking to do on primary if they're already diabetic?
Educate them.
No, yeah, you can educate them. What are we going to educate them on? Like your high cholesterol, what high cholesterol is. I mean, they're not going to have symptoms of high cholesterol, but you could educate them on high blood pressure, right?
Right.
And we could educate them on anything that's not diabetic tied to the diabetes. Other things may be popping up, but let's look at our secondary, and that'll help us a little further as well.
Secondary, checking their A1C every 3 months, getting a blood glucose, CBC, looking at their urinalysis for like proteins and things like that to see if maybe eventually like screening for any kidney disease related to their diabetes, looking at their skin for any sores, anything like that, looking at their feet, checking their blood pressure, looking at their weight, and maybe possibly referring to like an eye specialist, a vascular specialist, or a neurology specialist.
All right, and be careful with vascular and neurology. Why are you referring to neurology and vascular?
Well, we thought vascular because diabetes can affect like the blood vessels and the whole vascular system. And then neurology because we thought that a lot of diabetics tend to develop neuropathy. So we wanted to.
But that's
kind of
not a screening.
that.
Yeah. Okay. Okay. Yeah, I understand. So you're screening by sending them the referrals. Good. Okay.
Right.
Yeah, good.
And then finally, tertiary. There's different insulins we can give, anti-diabetics that are both oral and injectables, weight loss, healthy diet, and then continuing to monitor blood glucose and A1C. And then we can also refer them to different support groups for cardio and stroke rehab programs if they have those because of the diabetes.
Good. Excellent. All right. So just be really careful with our primary, secondary, and tertiary preventions. And we have some really good examples here that this group worked on. Good. All right. Healthy People 2030. This group worked hard and went through and saw some objectives. we became very familiar with the Healthy People 2030 website, which was our big section in chapter 1, right? I mean,
Yeah.
week 1. So tell us what you guys
So,
found.
basically, more than 30 million people in the United States have diabetes, and it's the 7th leading cause of death. Healthy People 2030 is focusing on reducing diabetes cases, complications, and deaths. And basically, their goal is to reduce the burden of diabetes and improve the quality of life for the people who have it or who are at risk for it. Some of the things, like after discharge, we can make sure we teach them and give them education on how to properly take care of themselves with foot hygiene, nutrition, medication, things like that.
Good. And we saw some of our objectives with our Healthy People 2030 ladies in that group. What were some of the objectives that we're monitoring with our Healthy People 2030?
A big
We did-
one was the sorry.
No, go ahead.
Education. So I know a thing that wasn't increasing when we saw it, when you showed us it, was the increase the proportion of people with diabetes who get formal education. Unfortunately, on Healthy 2030, there was like no progress to that whatsoever, which is ironic considering how a big thing of our job is educating them.
Good. And so that was one of our objectives. Another objective was to reduce the
A1C.
the hemoglobin A1C less than 9 was very specific. What I liked here is that this group focused on our objectives of Healthy People 2030. Well, it's not diabetic related, but this was in our reading. It focuses on really reducing our burdens and improve quality of life. That's our goal with Healthy People 2030, is to improve our quality of life. So I'm glad that you guys saw that and you pointed that out. And that's with everything. It's not just with diabetes, guys. Healthy People 2030 addresses all kinds of conditions and things like that, which you guys are probably familiar with. So good work on that one. All right. Cultural competency, and how did this play a part? And the second question was, how could this be brought to the community? So this is where, with the community, we were going to be doing some home visit information and family assessments and stuff like that. So go ahead. Group 4. Raphael, Michelle, Brittany, and Paola was in that group. So somebody tell us about your findings.
So some of the religion, big part in some stuff. You need to know how the different cultures handle that. Some people might have the fear that it's punishment, might interfere with their religious obligations. And some people just in general don't believe in medications and believe more that like prayer is going to fix it, or they're more towards like holistic measures instead of actual medication from a medical provider.
Good.
Socially, when it comes to some of this, it can be seen as a burden to others. People are embarrassed by it because they're having to check sugars all the time. They're having to really pay attention to what they're eating. There has to be some sort of balance in their diet, of which they may not be used to. Family, there's a lack of support. Sometimes people just don't have that family dynamic where they have somebody that can help them understand certain things or help them be able to change certain habits. There's just no support whatsoever for them. Or it's quite opposite. They have family support, but their family is completely whatever it is they're suggesting they do. Maybe telling them that everybody in their family has been fine and they'll be fine too. They don't need this or they don't need that. I think a big thing is there should be more education, especially when it comes to religions, maybe having different things to be able to give to patients who are set on eating certain foods. maybe like a this for that type deal that stays within their realm of what they're used to, something that has a generally same like texture, can be cooked the same way, but is more healthy for them to eat. Or it could be something as simple as just changing the way they're cooking what they're eating, to help with that. Better assessments for some of the different cultures, because their diets are going to be a lot different than, you know, a traditional quote unquote American diet. You know, in the South, we eat lots of fried fatty foods, lots of butter, lots of things we shouldn't be eating, which does not help these problems. But other cultures are not going to be eating that way. They're going to be eating much differently.
Okay, and how are we gonna bring this to the community?
So whenever, you know, you have doctor's offices or community centers, community health places, possibly even in grocery stores. I've seen things in some of the grocery stores now where they have signs up that have like a this for that swap with just pictures. So it's easy for everybody to be able to kind of grasp and understand where it's got arrows. Just as making healthier options and switching out things.
Okay, and so from this past week's reading, we had a lot of information on families and on health risks and things like that. And this is one thing we're looking at, is bringing it to the community and our cultural competency, because we're going to be assessing our cultural competency oftentimes in a community in the home setting. So what are some things that we're going to be looking for in a home that's going to identify what's going on in that household or that community?
So what kinds of foods they have in their refrigerator, where they keep their dry foods, water, electricity, do they have working appliances? If they do, who does the cooking? How many meals are being cooked in the home versus how many are being eaten out? What are they using to cook foods with? Like, is it lots of butter? Is it oils that maybe they need to switch to a different one for?
Okay, so, and we can work with our cultural competency, knowing our own biases as nurses, right? And being very careful when we're in the home setting and in a community setting that our biases are put beside. As long as we identify them, they're put beside. Okay, good. So now we're going to look at our last section, which is community-based and community-oriented. I didn't get you guys because we were tied up, but tell me, what's your definition of community-based nursing? Oops. Hold on a minute. What is our, with our community-based and community-oriented? I brought this up for you guys to see. Can you guys see this one? So there is no confusion. I didn't get to meet with you guys. So what I will tell you is, on our community-based nursing, please remember that we're going to focus on illness care, and our community-oriented, we're going to be promoting quality of life, healthcare of communities, and public health nursing, right? So what can you guys tell me that you added into your Jamboard? Anybody in this group? Guys, you got to participate. This is part of your part of the class. So whoever did this group, I don't remember who was in this one, but I had written down some. So tell me what you did about, so community-based and community-oriented are very specific definitional concepts that we learned in our reading this week, okay? So like we just spoke of, one is illness care and one is more about promotion of well-being, promotion of wellness, helping the community, our public health nursing. So someone in this group, whoever was in this group, what kind of things were you thinking about? Andrea, what group were you in?
I was in this group. So for community oriented, we focused on health promotion. So which is, regular screening, diet and nutrition education. Teaching about healthy weight and maintaining healthy weight and exercising.
Okay, so okay. And then with our community-based, what else did you guys find on your Jamboard? Because this one looks like it was, I didn't get to meet with you guys, so I apologize, but these are two major concepts that were covered this week that I need you guys to be really comfortable and familiar with, okay? So community-based is one and community-oriented is the other. One is gonna focus on illness and one is gonna focus on wellness, okay? So it's very specific when we're looking at those kind of things. What kind of things are we gonna focus on for wellness among diabetic discharge teaching?
So we're gonna make sure that they know how to administer their medication. And how to do blood glucose checks.
Okay, so what you're talking about now is illness care because they have an illness. So we're caring for the illness. How are we gonna do well care, promoting public health wellness among diabetic teaching?
Would it be like making sure that they get their annual exams, eye exams and stuff like that?
That's not public health, but I guess it's good for everybody to get an eye exam. What else are we gonna worry about? For our public health, what kind of things are we gonna promote wellness? So we have public health nursing working among discharge teaching with diabetics. My primary, secondary, and tertiary group, what were some things you guys did with primary that is gonna promote wellness among a community?
Vaccines. Vaccinations, educating.
The importance to the community of vaccines. What else? Very good.
Educating on different risk factors.
Yeah, we can educate on risk factors for sure. We're educating on risk factors, so we're not evaluating for risk factors. We're just educating. These are the things that will put you at higher risk or more risk. Good. Good. All right. So be very comfortable with community-based and community-oriented. We did not get a break tonight, and that was intentional because the case studies are taking a lot of time. And so that's why we will not be having a break tonight. What I'm going to do is we'll go over what's due this coming week. You guys have a discussion to do. Let's take a look at our what we have for this week. Let's see here.
Is there a link for the Kahoot we did that you can post or no?
I don't usually post them because they're not published, but I can give you the Kahoot if you want. I just don't usually do it, but I can. It's not, to me, it's we're all the same. All right, let's take a look at this week. I'll put it in the chat, the Kahoot, if you want.
Thank you.
Let's see here. We are at week, you guys have something that's due tonight at midnight, and that is our discussion question number 1. It only looks like I have 9 submitted so far, so please make sure you get that in by midnight tonight. Your responses to your 2 peers are going to be in by Sunday. So make sure, that's why the due date says the 22nd, because the assignment has to stay open. But if you read the instructions, it says it's due tonight, Wednesday. Remember, we cannot take late assignments. We also have our NCLEX review questions this week. This was in our announcement as well. So take a look at your discussion question. Please make sure that's submitted. APA format and everything. You're going to have these 3 ailments. What I will tell you is this, guys, is be very careful where you're getting your writing from, and please do not cut and paste off the internet. Because I will tell you that we have a 0 tolerance policy, and this particular assignment, I have seen students cut and paste right off the internet. So please do not do that. You guys need to read about them, and you need to come up with 3 signs and symptoms, and you're going to be developing an education plan that has 6 points of education for your parents and your children. So here's your instructions due tonight by midnight. Here is our rubric as well. And you need to respond to 2 of your peers with APA formatting by Sunday. So that will be discussion number 1. And then you have your NCLEX questions as well that are due. Any questions on that?
So if we cite our stuff, that's not like if we copied and pasted that's inside it, that's not plagiarism, correct?
Yes, it is. You cannot cut and paste off the internet and put, this is where I got the source from. What you can do is you can read what's on the internet, and this should be everyone so we're clear. When you plagiarizing is taking something off of another person's writing and putting it in as your writing. So no writing assignment in nursing should be cutting someone's writing and putting it in as yours. So Anna, for example, if you have a paragraph, the signs and symptoms of conjunctivitis are blah, 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 like bullet points. What you're going to do is read that and you're going to interpret it and write it in your own words. Okay, just like I would expect everyone to do. And this is not the first class that we should be doing this. So I'm hoping that you guys have had practice in writing.
So I've done it before, but when we cited, I guess I'm getting confusion on that, because I thought not citing it and then not quoting it and making it sound like it was your words, that's when it's classified as plagiarism.
No, so plagiarism is going to be unless you put in quotation marks, and I'm not asking you to quote off the internet. I'm asking you to write a paper, and I'm asking you to describe signs and symptoms and an educational plan. I'm not asking you to Google and cut and paste off the internet.
Are we able to edit our thing then, or do you want me to start a whole another one? Because the
No, you
edit,
can edit. Yeah, you can
well,
edit.
your edit is disabled on ours because I tried to do it earlier this week. I actually
Okay,
emailed
so
you
just
about it.
edit your copy and email it to me if you have submitted it already.
Okay.
Because anything that's locked, I have to lock because of due dates. Dr. Brown has asked us to be very rigid on our due dates this quarter, so I have to lock things because of that. So that's why it won't let you edit probably. And you're only allowed to submit one time, but I'm okay if you need to change it. So just so we're clear, guys, nobody should be cutting anything off the internet saying the Mayo Clinic says, you know, red itchy eyes. How could we reword red itchy eyes if that's what they say is a sign or symptom of conjunctivitis?
Itching of the eyes.
Itching of the eyes. What else could we say?
Eye irritation.
Eye irritation. What
Eye
else? What?
Eye
we can say-
discoloring.
well,
Eye
we can say
discoloring. Good.
Inflammation of the eye.
Inflammation of the eye. Yeah. But if we were trying to do red and itchy, you guys just gave me 5 different ways you could say red and itchy, right? Is that clear? Everybody clear on that? So we're not, because I don't see any benefit, and I don't know anybody that would see a benefit. Do you guys see a benefit to going to the internet and cutting and pasting information and submitting it? What have you learned by doing that? What do you learn by cutting and pasting off the internet? I'm just curious. Everybody knows how to cut and paste.
I guess it just depends, in my opinion, but
What, I mean, you know, I'd love to hear what anyone thinks, if what you're going to learn of cut and pasting off the internet, other than cutting and pasting, which I'm sure everybody knows how to do by now.
I mean,
Right?
you have to research, so you have to read what you're looking at, so you're retaining it because you're researching it. You know what I mean?
Yeah. And when you're reading it, you're retaining it. And so if you're retaining it, then you can spit it out in your own words, right?
So you don't. Okay, so you don't want us to have any sources at all?
Oh, no. You're going to have sources because you guys are not coming up with signs and symptoms of conjunctivitis, right? You're not creating them in your own head. Right?
It's your interpretation of the information you're
Correct,
reading.
Martha. Correct. You guys should know at this point in our nursing education, there should not be anything that is not cited. APA format is expected in community nursing, and I can't speak to other classes, but I know it's expected here. It will be expected in leadership as well. So the further along you guys get in your education, and if a lot of you want to go on in education, and please do know that this type of writing is going to be required in any master's program, any bachelor's program, any nursing writing. So my suggestion is just get used to it. And I'm giving you a warning because I've read this paper so many times, and it's very obvious to me, and I check sources. I click on the websites myself. So only because I think that's the way we learn. Any questions?
Just to make sure I'm like not getting confused. So like I'm putting things in my own word. I'm not going to quotate anything in my paper at all, but like just do a references page. Like you get what I'm saying?
Yeah. So for example, I'll show you an example because this seems to be a little bit of confusion, and I'm glad that we're having this conversation so that We don't have this. And so if we look at, I'm just typing in real quick and I'll pull up for you guys. Why is this so slow tonight? All right, so if we look at the Mayo Clinic as one of our sources, mayoclinic.org, okay, which is not one of our best sources, but I'm just doing it quickly for you guys so that we can move along. And if you click on here and you search diseases and conditions, and then you put in C for conjunctivitis. And then you go down. And remember, Purdue Al is where we're using our, is what we're using for our citing when we're putting things in our reference. But here we go. Conjunctivitis, if we click on this. So if you look right here, and I can tell you that it says pink eyes and inflammation of the transparent membrane that lines the eyeball and blah, blah. The membrane is called the conjunctiva with small blood vessels in the conjunctiva become swollen and irritated. They're more visible. So I do not want this paragraph given to me because I know that you did not write this. What you can pull off of here may be something about pink eye being viral. So it may be viral, it may be bacterial. And then we come to our symptoms, right? And we just talked about how restating some of our symptoms. So don't put the most common pink eye symptoms include ... and bullet points because this is their writing. And so then once we take the information that we get off of here and we interpret it and we understand it, then at the bottom on our reference page, we are going to reference the mayoclinic.org and the website, the title, and the day it was accessed. That's how we do it. So the title is pink eye conjunctivitis. Okay.
But you're also still wanting in-text citation as well as reference, correct?
Absolutely.
So when we rephrase, the in-text citation needs to be in there.
Yep.
Right afterwards. Okay.
Right. Yep. Okay, so no confusion on that. Okay. Alrighty. So if that's what's been going on in your other classes, please share that with me and I will share that with Dr. Brown, that you're allowed to cut and paste off the internet, because then our expectations are not standard across the board. So, and that has to be, you know, as faculty, we pretty much have to be standard across the board. So let's make sure if that is the case, you email me privately and tell me what classes are allowing that for writing. Okay. I know some classes you don't get a lot of writing too, so I don't know how that goes, but any questions on that? That's due tonight by midnight, and then your 2 responses will be due by Sunday. Okay, best of luck to you guys studying. There are review sessions all week. Please attend one, and I will put the Kahoot in the chat right now if you guys want.
I have one question. Still, my book is not accessing online here on the Vital Source.
Did you see that the announcement that I just posted from Dr. Brown about the book?
Yeah, I saw. I tried to download. I have a other one like a maternity and a pediatric one on this Vital Source book on the there, but I didn't find.
Okay, stay on after class and we'll find it. Okay.
Okay.
Because that shouldn't be a problem. And reading is a huge part of this class. So I need everybody to make sure you're staying up on the reading, because as you see, we're not going to be doing like lecture during the class, like I said, because we're doing more application and community this quarter. All right, and there's the Kahoot if you guys want it.
I can help with my book also. I've been kind of like,
yeah, no worries.
doing
Just stay
research
on
internet too, because I
yes, just stay on. I can access. All right, everybody else, you guys are free to go. Have a good night, good week. Best of luck studying. Take care.
Thank you. Have a good night.
Mrs.
Thank you.
Aloni, are you going to be posting your exam review after you're done with it?
Yeah.
Okay.
Yep. Everybody will be posted. Everything will be posted.
Okay, sounds good. Thank you.
Okay. All right. Have a good night.
You too. Thanks.
Okay. All right. So let's see. Roxanne, are you okay? You were put in the waiting room, but I'm going to put you in a breakout room for 1 second. Because I want to talk to you in 1 second. All right, Om and remind me, Esther. I'll be right back. Okay. All right, Roxana, you're in room 1. I'll meet you there in a minute. Alrighty, so we're looking for the book, right?
Yes.
All right, so let's go. Anna, do you need something?
I had a question about something about my
Okay, I'll put
grade.
you in the breakout room then, okay?
Okay.
Hold on. I gotta close them all and reopen. All right, I put you in 1.
Professor Aloni, you're gonna have an exam review today, right?
Yeah, in 15 minutes.
Awesome. I'm gonna stay for that. Thank you.
Esther. How is your preparation? Good?
Yeah. Yeah. Everything's good. How are you?
It's good.
Yeah. Are you ready for the exam?
Is it this one is next week, no?
Yeah. Next
No, next week.
next
yeah.
Wednesday. Yeah. Next,
Yeah,
in a
next
week. Yeah.
Tomorrow is a quiz for the mental health. Oh, yeah, tomorrow.
For mental health?
Yeah,
Tomorrow?
tomorrow, yeah. Did you read that 1, 2, 3, 1, 3, something, 9 chapter, something there like first lecture?
No, I did not. No, I'm just kidding. I did. I read 1, 2, 3, and I believe it was 9. Was
Yeah,
it 9?
something 9. Yeah, yeah.
9.
Yeah, 9,
Yeah. So that's it
yeah, that's all
for the
for the
quiz?
first. First quiz, yeah.
Okay, I'll be okay then, because I have clinical tomorrow.
Oh, you have a clinical?
Yeah.
Oh, did you finish the SIM for the mental health? Or like this maternity? How many SIM you did already so far?
We don't have any SIMs for mental health. We have
How
clinicals,
far?
3 clinicals.
Oh, okay. So you and I have the same number of subjects, like 3. I think we are in the same classes there all the time.
Do you have a clinical tomorrow?
No. Mental health. What date? Is it 26? I think I have it. I see that.
Make sure you check your emails because they changed the days again.
Okay, I'll check.
Remember how they switch them to Saturday? They switch them back
Yeah.
to Thursdays.
But they moved to the previous one. Previous one I have 26th of January. Not this. Yeah, I think.
Okay.
I think, yeah. You have a mental health or which one clinical? Or maternity?
I have a clinical for mental health tomorrow.
Oh, okay. I have next week after that.
Yeah, there's only 3, so that's not that bad.
Yeah, it's not bad and it's good. I think you are with Gopal and Vidya, not me.
Yeah, and then I have Emily also.
Emily. Is it Emily is doing capstone or what?
She is.
Oh, okay.
Yeah.
Okay.
Yeah, I think I have. No, I don't think I'm with Vidya. I don't think so. I know that I'm with Emily and who else? I
That's
don't know.
all. Yeah, tomorrow is a mental.
So yeah, I have Gopal, Emily. Oh yeah, I got Vidya.
You guys have tomorrow? Is there tomorrow? Is it 19th?
The 19th.
Oh, is it first is yours? Then I have a second time. Okay, that's fine. It's not me. I'm good.
Yeah. Good for you.
Yeah, it's good. I know I'll finish my scene.
Yeah, good thing you remind me about the quiz because I completely forgot. For mental health.
Yeah, tomorrow is a quiz, and even we have Friday also quiz. Do you know maternity? No, not the maternity. Also quiz.
Oh yeah, on Sunday, this Sunday.
Friday, you have a Friday also. Which day you have a maternity?
Oh my goodness, the quiz is going to be during class, right?
Yeah, everything on Friday, like Friday also, tomorrow also, and exam also same. We have same 1 week, all the 3 exams.
So we don't have, I was thinking that I was going to do my quiz on Sunday, but no, because now we have to do it in person, like during the class.
Yeah,
Oh,
we do in the class.
Oh, okay. Okay, so I won't have, I need to study like right away.
All right, so I'm gonna share my screen with you guys, okay? And we're gonna all try to do this together. So go to your dashboard. Hold on, let me get to dashboard. Or I don't know what you call it. Your page where the modules are.
Okay, modules, yeah, I'm in the modules.
Yeah, I'll show you here. Okay, you're on this kind of page, right? All right, so if you go to home.
Okay.
And then you go to modules.
Modules.
And then you go to student resources right here. Here is your textbook.
Oh, the vital. Oh, okay, just a minute. Wait a little bit down.
Yeah, so
Okay.
here's the book itself. If you click on it.
So you go to buy.
And it just opens your book for you.
Oh, okay, we got it.
See here. Here's your book. It's opening, it's just taking forever. Did that help?
Yeah, it is. I found the foundation of population health and community public.
Yeah, good. That's the book.
Okay, I got it.
You got it? So
Yeah.
all those chapters, and they're broken into different sections. So when you're looking for something like a chapter, you have to just click on the section on the left-hand side. See, section 1 is like chapters 1 through, I don't know, 7 or something. See it?
It's a lot, yeah.
No, it's a lot of reading. I know it is, but what I want you to know is that if it were a textbook in your hand, it would be a lot of writing too. But nursing is all about lots
So
of
we
stuff.
have
So
to
there's
go all the chapters, or is that okay to go PowerPoint only? So I don't know. There's probably.
go to the chapters because we can't copy, we can't cover every single thing in every chapter, you know what I mean? We don't have the time. We need a class for about 17 hours a week.
Okay.
So it's, this week was 1, 2, 3, 5, 9.
Yeah.
And then next week 2 is 20, 21, 22, 23, and 31.
So for the first term exam, we have to prepare the week 1 and week 2 chapters only.
Yeah.
Okay. Okay.
By next week. So you'll have your test next week. But the study guide is really helpful. Esther, did you get in?
No, I got last right after student resources, and then you went to virtual. Is it clinical or?
Nope, it's student resources. And then when you're under student resources, are you on your computer?
No, because
okay. All right, well, if you don't want to go on it, it goes student resources, vital source, and then it has your book right there, Foundations for Population Health. And you just click on that.
Yeah.
Foundations. Okay, there.
Good.
I got it.
Yeah, you'll get it if you go there.
Okay, thank you. Thank you.
You're welcome.
Oh, there.
All right, guys, so I'm gonna log off because I'll be back on. I will join back on in like 6 minutes, 7 minutes or whatever. I just have
Okay,
to.
let me take. Yeah. Okay.
Okay.
Yeah,
Thank you
we'll
so
do
much.
Okay, all right. Good night, everybody.
Bye.